The House of Representatives has commenced investigation into the implementation of the $696 million Nigerian Community Action for Resilience and Economic Stimulus (NGCARES) social intervention program of the federal government. The investigation being championed by the House Committee on NGCARES is towards ascertaining and rectifying any possible mismanagement or misappropriation and misapplication of funds. Chairman of the committee, Mr. Abubakar Kusada, said while briefing members of the press after a meeting on Wednesday at the National Assembly that the investigation became necessary since the masses were barely feeling the impact of the palliatives and safety net despite the federal government fulfilling its funding obligations, providing the guidelines as well as the operational arrangement for the effective implementation of NGCARES. He said a total of $696 million, approximately 1.06 trillion naira, had been released as social intervention safety net and palliatives to Nigerians in the 36 states and the FCT through various delivery platforms.
The embassy's investigation should provide answers to the following nagging questions that create the disconnect between cause and the effect. 1. Were the funds embezzled? Were the funds misappropriated or diverted to some other purpose in the state? Does the utilization of the fund create enough value for money? In other words, was there an undue inflation of contracts? Can the integrity and the fairness of the procurement process stand scrutiny? In other words, does the contract procurement follow due process? Does the inbuilt safeguards, IVS and TPMs operate effectively, or does they become compromised and fail? Was the distribution of notional amounts fairly done? Why did some states manage to get more than the attributable notional amount? Why does the operational mechanism fail in a number of states? How can the operational mechanism and delivery platforms (DFIs) be strengthened across the state? Should training workshops be organized for NGCARES operative at the state and strengthen the operational mechanism and effectiveness of the delivery platforms?
The lawmaker disclosed during the committee's meeting that data obtained from the Program Coordinating Office in Abuja to ascertain the implementation of the program since its 10 years of running showed that several states already claim billions of naira for social transfer. He said the committee would work with the information to deliver on the mandate of accountable oversight.